It is in many ways preparation for battle. 22 new ventilators arriving at the Royal Melbourne as beds slowly fill with COVID patients, and many of them will be under 50.
What we're seeing now is people who are young who are going to die.
But just a few kilometres away, a group of young people at a skate park breaching stay-at-home orders, not a mask in sight.
We're here day and night, 16-hour days, working to make sure we're ready, looking after the patients we have, and to hear people are not taking it seriously is so disappointing.
The latest health department figures prove Victorians of all ages are seriously ill with COVID. A child under 10 and 3 teenagers are in hospital, and of those in intensive care earlier this week, 9 were under 50. That's 1 in 4. And being in the ICU is a confronting experience.
They're very critically unwell for the first 4 or 5 days in ICU. They're placed on life support. We do proning, where we turn them onto their stomach because it's much better for their lungs.
With so many cases this week and many more Victorians still being tested, hospitals are bracing for an influx of patients. Here at the Royal Melbourne alone, they're expecting up to 50 intensive care COVID patients within the next 2 weeks. And experts say some may never fully recover.
At this point, we still don't really know what those long-term complications are.
But early indications are of serious and ongoing chronic conditions.
They've had problems with concentration, with memory, long-term struggling with fatigue, struggling to get out of bed, struggling to get through their day-to-day activities. So it can be quite devastating for some people.
A message frontline workers hope will convince all Victorians, especially those who think they're immune, to take COVID seriously.